Ever woken up in the middle of the night with your big toe on fire? I mean, so painful that even the weight of a bedsheet feels like a ton of bricks? If you've ever experienced that, you might have met the king of joint pain, gout. But wait, isn't that just a type of arthritis? Well, yes and no, let's break it down. When we say arthritis, most people think of one thing, but it's actually an umbrella term for over 100 different conditions that affect our joints. Think of it like the word dessert. Dessert could be ice cream, cake, or a fruit salad, all very different, right? Similarly, arthritis includes conditions like osteoarthritis, OA, rheumatoid arthritis, RA, and our star for today, gout. And trust me, you need to know the difference because how you treat them is worlds apart. So let's start with the big one, osteoarthritis or OA. This is the wear and tear arthritis. Imagine the cartilage in your joints is like the tread on your car tires. Over many years of use, walking, running, just living, that tread wears down. This is OA. It develops slowly, gradually over decades. You might notice your knees getting a bit stiffer in the morning, or your hips aching after a long walk. It's most common in weight-bearing joints like the knees, hips, and spine. It's a mechanical problem. Then we have rheumatoid arthritis or RA. This one is completely different. RA is an autoimmune disease. Your own immune system, which is supposed to protect you from germs, gets confused and starts attacking the lining of your own joints. It's like friendly fire inside your body. RA often shows up symmetrically, meaning if your right wrist is affected, your left wrist probably is too. It causes swelling, pain, and can lead to joint deformity over time. RA isn't about wear and tear, it's about an internal battle. Now let's bring in gout. Gout is a metabolic arthritis, and this is what makes it so unique. It's all about a substance called uric acid. Uric acid is a waste product created when your body breaks down compounds called purines. Where do purines come from? Well, they're in a lot of delicious foods. Red meat, organ meats like liver, certain types of seafood like shellfish, and even beer. Normally, your kidneys filter out this uric acid and you get rid of it. But sometimes either your body produces too much uric acid, or your kidneys can't get rid of it fast enough. When that happens, the uric acid levels in your blood get too high. This condition is called hyperuricemia. And here's the twist. That excess uric acid turns into tiny, sharp, needle-like crystals. These crystals then decide to set up camp in your joints. Imagine microscopic shards of glass being injected directly into your joint space. That's a gout attack. And it's why the pain is so sudden and excruciatingly intense. It often strikes overnight, famously in the big toe, but it can also hit your ankle, knee, or wrist. One minute you're fine, the next you're in agony. While OA develops over years and RA builds up over weeks or months, a gout attack can hit you like a lightning strike. Let's use a real-life example. You go to a summer barbecue. You have a juicy steak, a couple of beers, and maybe you get a little dehydrated in the sun. That night, bam, your big toe feels like it's being stabbed. That's a classic gout scenario. The steak and beer loaded your system with purines, and the dehydration made it harder for your kidneys to flush out the resulting uric acid. Now compare that to your grandma, who says her knees have been getting progressively stiffer for the last 10 years, especially when it's cold and rainy. That sounds more like osteoarthritis. Or your friend in their 30s who has swelling and pain in the knuckles of both hands and feels exhausted all the time. That points more towards rheumatoid arthritis. The good news? Gout is one of the most manageable forms of arthritis. Unlike OA, which is about managing degeneration, or RA, which involves managing the immune system, gout can often be controlled and future attacks prevented. With lifestyle changes, like drinking plenty of water, limiting those high purine foods, and maintaining a healthy weight, you can make a huge difference. There are also excellent medications like allopurinol that can lower your uric acid levels and stop those crystals from ever forming. So understanding the difference isn't just trivia. It's crucial for getting the right diagnosis and the right treatment. All joint pain is not the same. And by knowing what's happening inside your body, whether it's wear and tear, an immune attack, or tiny crystals, you can take control of your joint health and get back to living your life pain-free.